Good afternoon. How is your weekend going? Hope everything is fine. This is the Fashionable Midwife coming to you this beautiful afternoon to tell you about the interpretations of your abdominal scan in pregnancy. You know, in some of the video I made sometimes ago, I told my subscribers that as a pregnant woman, if you go to the hospital, make sure you ask questions. Ask questions from your doctors, ask questions from your midwife. Whatever you don't understand, even the medical jargons or midwifery terms, you don't just go to antenatal and you just be looking. If there are things you don't understand, please ask. There's no offense in that, and I know gladly they will explain to you. It's very important, to always ask questions. Just like we tell our children that they should ask questions. It's very important, very, very important. Excuse me. Okay. So it's very important for you to ask questions even as an adult, because some of these pregnant women, they will just go, if you ask, maybe from another hospital, they refer them to come and do scan. They will do the scan, take the result to their doctor, and if the doctor just say, your baby is okay, there's no problem, they will just go. But there are some things that you need to know, that I want to tell you some of it this afternoon, so that next time you go for scanning, you will be able to ask questions. Don't just take it that shebi they have told me everything is fine. No, 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 no. You need to know some things, and there is nothing bad in learning new words or in learning new things. It's good, so that maybe one day you have a friend, or just anybody could ask you that, what's the meaning of this? You've been pregnant before and you've been going to antenatal clinic, you've been going to see your doctor. Please, can you explain this to me? The little knowledge will be useful. So there's no knowledge that is a waste, or there's no knowledge that is a loss. Whatever you learn, whatever you know, will be with you forever. So please, it's good for you to always ask questions from your doctor and your midwife. So there are some abbreviation used in scan results that has meaning. Like, your doctor can write in your scan result that the presentation of your baby that is growing in your abdomen. That presentation, it may be cephalic, it may be breech, and it may be transverse. When the baby's presentation is cephalic, that means the head of the baby is down towards the birth canal and the legs are up, which is mostly the normal presentation that a baby can have. Then if it's breech, the head will be up and the legs will be down. And if it's transverse, the baby is lying horizontally across your uterus. And in most cases, these transverse cases may end in a cesarean section, or if the baby changes the position, or if you have external cephalic version done by a well-experienced doctor, it's possible. So cephalic presentation is very common. Breech can be delivered normally, no problem, if you have an experienced midwife. But if there are any, if there's going, they see that there's going to be any complication, I think I've spoken about this before, the then CS can also be done. But when the baby is lying horizontally, this is the uterus, and the baby, instead of the baby to be like this, maybe the head down, the legs up, or the head up, the leg down, but the baby is lying like this, is transverse position, horizontally across your uterus. That is what it means to be transverse. Then we also have what we call EDD. EDD means expected date of delivery. That is, if they say you deliver on the 27th of September 2025, it could be 2 weeks before that 27th September, or 2 weeks after that 27th. That is what we mean when we say EDD, and that is expected dates of delivery. It's very good for you to know all these things. Then when we say LMP, that is last menstrual period. Last menstrual period means the first day that you saw your menses last before you now got pregnant. It's very important. Thank you for the like. Please keep on liking it. So last menstrual period, this will help us to calculate your EDD. When we know your last menstrual period, we calculate it from that first day of that last menstrual period to calculate your expected date of delivery. And this is very important. Most women, they say they don't know. Even sometimes when you know it, you can calculate it by yourself, you know. And some women, when you ask them, how old is your pregnancy? I don't know. When your pregnancy is 4 weeks, that's 1 month. When it's 8 weeks, that's 2 months. When it's 12 weeks, that's 3 months. When it's 4 weeks, that's 16 weeks. We calculate it in weeks in the hospital. And I've liked you from Indonesia. Do you know Indonesia? Greetings. Oh, thank you. God bless you. I just got out on parole and I'm looking to crack something. Where you are sugar food. Oh, thank you for liking it. God bless you. I love traveling. I pray that one day I'll come to Indonesia. I love travel. This year I've been to the United Kingdom. Last year I was in Canada. I pray that, one day I will get to your country because I love traveling a lot. I want to explore. I just want to, travel. I love it. I love it. I enjoy traveling. So then we have also EGA, expected gestational age. When you tell us your last menstrual period and we calculate it, and when we now palpate, there's what we midwife do. When you come to the antenatal clinic, we palpate your abdomen to know the weeks of your pregnancy. So we expect that expected gestational age should correspond with the history you have given unto us. So it's very important, and that's why we always ask, when was your last menstrual period, your LMP, before we now arrive at your EDD. So it's very important. There's also what we can see on the scan results. We call it AF. This is amniotic fluid. AF, amniotic fluid is like a cushion, like the baby floats in it when the baby is in the uterus. The baby is inside that amniotic fluid, and that sac is always in the uterus like that, and the baby continues to grow with. The baby feeds on the amniotic fluid. So the amniotic fluid can either be adequate or inadequate. You understand? So if it's adequate, that's normal. If it's not adequate, it's not normal and can be get treated. And we can also tell you to always drink enough water so that your baby can float very well. And whatever you take, the baby gets it from from the placenta through the cord to the baby. Then we also have what we call FHR, that is, fetal heart rate. And this is usually between 110 to 160 beats per minute. This is very important because sometimes the baby can also be in distress even while still in the uterus. So many things can lead to that. Or when you are in labor, the fetal rate can drop, the fetal rate can be higher. So if you know the normal fetal rate and they are talking about it, you will be able to ask questions. So it's good for you as a pregnant woman to know all these things. You don't just go to hospital, sit there while they just tell you what you don't know and you can't ask questions. So it's very important for you to know some of these things. Then we have EFW, estimated fetal weight. It depends on the weeks of your pregnancy and the scan and when the scan was done. So this will also tell you the estimated fetal weight. Is very important because good afternoon, Ngozi Lovett, good afternoon. Thank you. I know you're a Nigerian from your name, you are Igbo. So thank you, amigo Josma Barbosa. Thank you all. I appreciate you. So it's very important for you to know all these things. Estimated fetal weight depends on the weeks of your pregnancy and the scan. Then we have PP, that is placenta position. The placenta could either be in the anterior part of the uterus. That anterior means the frontal part of the uterus. It may be posterior, that is the back, and it may be the lower lying part of the uterus. And the other time I discussed about placenta previa and said we have different type of placenta previa. It's an emergency case in pregnancy because any woman we have the type, we have abruptio, we have accreta, we have different types, and this placenta previa can make the client to be bleeding, because if the placenta is situated at the very close to the cervix, this may cause the client to be bleeding, and this is very risky for both the baby and the pregnant woman. So it's an emergency case. So you should know this. When they say, the placenta is down, because most cases, if the placenta is situated and is covering the cervix, they may not advise you to have a VJ delivery. You can just go for CS, or they book you for elective CS after this, giving you an informed consent. This is very important, because if the placenta is covering the cervix, the patient will be bleeding and the oxygen will be depleted to the child, and the child could go into distress. And if care is not taken, the baby could die inside the uterus. We call it intrauterine fetal death. I pray that that won't be your portion. Then when the doctor now want to summarize this your scan, we write my impression on this pregnancy. That is signatum fetus. That is one baby. When it says signatum fetus, is one baby. You can write it's 24 weeks and with no gross fetal abnormality, everything is perfect. And if you now want to cap it, you now say, active and viable fetus. When you hear that, active and viable fetus, as a mother, you'll be very happy, because that means your baby can survive outside the womb. It's not all the babies that can survive outside the womb. So going for scan is very important, and you should know what all these things means. Not that they will just give you the result. If you're educated, and you don't have to be a nurse to know all these things, but it's good to always learn. You can Google some of these things. You can just have the idea, so that when you are reading it and there's some things you don't understand, you can always ask your doctor. You can always tell your midwife, so that if you feel anything, just like I used to say, that if you feel anything maybe in your body that is not, you are feeling, maybe you are bleeding before, you did not count it to be anything, you now read it that you had one woman talking this thing on YouTube, that if your placenta is low lying and is very close to your cervix, this will make you to bleed and it will affect your baby. Thank you, Malik. Thank you. Where are you from, Malik? Are you in Nigeria? Thank you. So you will know that this thing is abnormal and I've been bleeding. Any bleeding during pregnancy is not something that you have to joke with, no matter, because during the first trimester it may mean that your pregnancy is being threatened, and towards the end of the pregnancy, maybe from 28 weeks above, it could be this placenta insufficiency, and this could harm the baby, and it could also harm the mother. Anything bleeding. So when I hear today, when I was on TikTok, I was looking at some of these pregnancy TikTok. Most women, they will say even when they are pregnant, they are still menstruating for 5 days, and I saw some doctors telling them that it cannot be menses, because you are shedding your endometrium when you are not pregnant. That's why you menstruate. Now the baby is already lying on the endometrium, but some of them, there's nothing you say, they will never believe you. It could be implantation bleeding, it could be some other things. That's why we say, no matter how small the blood is as a pregnant woman, please go and see your doctor. Please go and see your midwife, for her to be able to tell you this and this and this. Bleeding during pregnancy is not something that you have to joke with. It's something that you have to take. In fact, it's an emergency, so that you will not have any problem. And just like in some cases, that there are some things that as a pregnant woman, when you see it, you don't joke. You go to the hospital, you go and get treated ASAP. I used to say it, don't wait until complication comes in. As soon as you are feeling that this thing is up, this thing is not normal, please go and see your doctor, so that you will get treated. As a pregnant woman, you are always having, there are danger signs. You are always feeling headache, your eyes is always blood, you feel dizzy. Please go to the hospital. It may be a sign of preeclampsia, it could be eclampsia, it could be anything. So don't joke with your life. Please go and see your doctor. Or your baby does not kick the way you know how your baby kicks, and for the past 48 hours you've not had any kick. Please don't joke with it. It's not normal. Your baby should kick very well, as it normally does. Then if you see blood coming out from your VJ, hey, people that are saying, I'm menstruating. I know one woman, she menstruated all through her pregnancy. How are you sure? The one that they're even using to deceive people, that is scripted pregnancy. They say, well, I'm not saying it's not possible, but you see some people will say, they will, even if you do scan, they will not see the baby. So where is the baby now? Where is the baby? Some of us that we are in the medical line, or nurses or midwife, when we hear all these things, we just be looking as if I don't understand. Because it's something that we've studied, it's something that we know much of it. Then, as a partner to a woman that is pregnant, please show her love. Show her, encourage her, give her that emotional support that she deserves. Encourage her and tell her that you are doing well. Thank you for all you do, my darling, my sweetheart. We women, we are moved by what we hear, and while you men are moved by what you see, please encourage us, and we're very happy. The other, okay, I have planned to talk about hyperemesis gravidarum. There, during pregnancy, you see that your vomiting is in excess. You know, this hyperemesis gravidarum can even kill a pregnant woman if it's in a severe form. That's why sometimes when they say, even in the hospital, they can advise a woman to go for abortion. If that pregnancy is a threat to her life, it's better to remove it, because this hyperemesis gravidarum, the vomiting is not the one that you will say, you can't even, anything that touches her mouth like this, you vomit it. And most times they will always be on drip, so that they will not go into shock. So many things that can happen, you know. It can lead to jaundice, it can lead to severe dehydration, it can lead to fainting. So many things that this hyperemesis gravidarum can cause. So please don't joke with your life. If you are pregnant and you have all these signs, please go to the hospital and get treated. Thank you, all of you, for being here. If you have any question, you could ask me, and please help me to like my live streaming. God bless you as you do so. Malak, thank you. I ask you that, where are you from? How are you gone? Do you know Stray Kids? I don't know it though. Ngozi Lovett, are you a nurse or you are a midwife? Asuka. Okay, thank you. So, it's just a very short topic, but it's very important. Just like I was saying, that hyperemesis gravidarum can make even the liver to pack up, can be the client can be jaundiced, you know, the blood pressure can become so low because she's vomiting, she's so weak. So all these things, a pregnant woman should not joke with it at all, at all. A woman that is always vomiting, that does not have, you know, she's so weak, you don't have to keep her at home and say, hey, are you the only one that will first get pregnant? You are always stressing me. Please, she knows what she's feeling. And I always say it every time. Some people will say, every time she's always saying this. As a woman that you are pregnant, you are the one that knows how you are feeling. You are the one that knows what is going on in your body. Please don't joke with your life. Go to the hospital. If that feeling is off, if you are not feeling good, you are feeling blood, you are having blood vision, you are having persistent headache, or you are having temperature, you know, things are not just, you just know that this is my body, I'm not okay with it. Please go to the hospital and get treated. Joseph Mengele, okay. Pop ATT. I don't know what you are talking about though. Thank you, thank you. You can drop comments. I've seen some people's comments. The voice of, I'm not a doctor, but I'm a midwife. And as a midwife, I have rights to talk about pregnancy, about newborn, about postpartum, and family planning. Yes, it's very important. I am a midwife. But my late husband was a medical doctor. He died 10 years ago. And we were working in the same general hospital in Zulu, Kebbi State, northern Nigeria. So, and when he was alive, he really helped me even in my job, because we work in the same hospital, and I was the matron in charge of maternity. So when I had any issue, maybe something, I would just call in. In fact, he was the first person that taught me how to do evacuation for a woman that, oh, thank you. Thank you, no problem. Life goes on. We'll all die one day. We only pray for long life to see our grandchildren. He died at 57. He was a medical doctor. You know, he qualified as a doctor from University of Lagos in Lagos, Nigeria. And he was 57 when he died. You know, that's life. But I'm living my life. Yeah, thank you. God bless you. And I can see that the voice of Christ, you are a child of God. I'm a believer too. Yes, I attend Bible believing church. In fact, when he died, you know, church really helped me. It's really helped. God has been awesome. God has been amazing, honestly. So I give him all the praise. Thank you, thank you. Thank you for your support. Thank you for your words of encouragement. God bless you. So when I started, I was talking about interpretation of abdominal scan results, that most pregnant women, when they go to the hospital after doing scanning, they can't even check it by themselves. They don't know what is written. And when they take it to the doctor, or the doctor will just say, your baby is fine, there's no problem. Some of them will even throw the scan result away. No, you need to study it. And from all these things that I've told you, you can know maybe your baby is presenting normally or abnormal. I talked about cephalic presentation, breech presentation, or transverse when the baby is lying horizontally. That this one could make the health care management to do CS. Okay, thank you. We made the healthcare people to book her for elective CS, because when the baby is lying across the womb, except in some miracles, the baby can turn, or there's this thing they do in the hospital, we call it a external cephalic version, that the baby can be turned gently. It has to be gently so that there won't be complication. But if you know that your mind is not with that, or they said that this is what can happen, I think it's better to go to just go with elective CS. Gone are the days when people are so scared of elective of CS now. Within 2 weeks, you see some of these women, they are already up and about taking care of their baby. So I also talk about the meaning of EDD. I said it's expected date of delivery, either 2 weeks before or 2 weeks after the date given to you that you will deliver. Like in case of when I had my daughter, I was up, they said November 21, but I eventually deliver November 29. So it could be 2 weeks before that your date, or 2 weeks after that date. I also talk about LMP, that means the last menstrual period. The way we calculate it, the first day, if you menstruated 21 to 23, so 21st will be the last menstrual, because that was the day you started the menstruation. So that's how we calculate it. Then I also talk about AF, amniotic fluid. If you see it written, is the water that used to break before or during labor. Sometimes it can even break prematurely, and it could be adequate or inadequate. If it's adequate, it's normal. If it's not adequate, it's not normal. Whatever your doctor tells you to do, you follow his medical advice. Then we have FHR, that is fetal heart rate. I said normal fetal heart rate ranges between 110 to 160 beats per minute. So if it's lower or it's higher, there's problem. Your doctor will tell you. Or if you know all these things and you see it, you can ask questions that, hope this won't cause any problem, hope my baby is fine. It's always good to know one or two things about your condition. That's why I like, asthmatic patient, diabetic patient, or hypertensive patient. Some of them, they can even give you as a nurse or a doctor lecture, because they must have read so many things. And when asthma, even asthma patient, when they want to have attack, they know. Even epilepsy patient, when they want to have attack, they know, because you feel them, they will have this blood vision, they will have this bitterness in their on their tongue. And you see some of them will just lie down where they will not injure themselves when they start fitting. So it's always good to know what is wrong with you. Whatever it is, read about it, know about it, and you will see that everything will be fine. So I think those then I talk about estimated fetal weight depend on the weeks of your pregnancy, and when the scan was done, we also have placenta position. Then I talk about impression. So you can see all these things, they are very important. And you as a pregnant woman, if you feel some things in your body that is not normal, please don't hesitate to go and see your midwife, to go and see your doctor, to get treated in time. And even if it's not pregnancy, when you are a human being and you are not feeling fine, whatever you go to the hospital in time for to get treated, the complication will be less. But when you are postponing it, I will go. And they said that Mama Shola, my neighbor, she said when she was pregnant, that's how she used to bleed every month. Don't do that, because our bodies are different. Don't compare your body to your neighbor. Don't compare your life with anybody. You are unique in your own ways. Even if you have twins children, if you look at them very well, you will see that something will make one of them to be unique, that will make you to know that this is Taiwo and this is Kende. So please don't compare your life with anybody. Make sure that you do the right thing. If you have any question, you can ask me. Ah, so if there are no questions, that's a short topic. I think I can go. Thank you for attending this my live streaming. God bless you. I know you must have learned one or two things. The voice of Christ. Thank you for your love and support. God bless you. May the Lord continue to strengthen you. And I pray for every woman this afternoon that you are trying to conceive, that the Lord will visit you, will open your womb, you will never be barren. Because even in the Bible, I think it was only Micah, Saul's daughter, that laughed at David when he was dancing, that was barren. Every other woman, they tasted birth. And he said that none shall be barren and none shall cast their young. So I pray for you that the Lord will visit you, the Lord will open your womb, the Lord will meet you at the very point of your needs. Don't allow that to weigh you down. You know, infertility is a joy killer, because when you are trying to conceive and anytime you see your period, you always feel sad. Please don't do that to yourself. Be happy, make yourself happy. God that created you will perfect everything that concerns you. He's a faithful God. His calendar is different from ours, and he's ever faithful. When he says he will do it, he will definitely do it. He's a faithful God. So please don't allow childlessness. I don't like saying a woman is infertile, because my God is faithful. Every one of us, we are fertile in Jesus' name. Don't allow it to weigh you down. Get some, that waiting period has a meaning. Get something doing. Make your life more sweeter. Listen to gospel music. Have an intimate relationship with your Father in heaven, and always pray. When you pray, let your faith supersede whatever you are asking for, and you will see just in no time God will visit you and you will have your own child. God is not partial. God is not wicked. God loves us. His unconditional love is incomparable with any love that you might have tasted in this life. So trust God that God will visit you. God will perfect everything that concerns you. Even me, I experience it. Though I have a child, I have a girl child, and she's grown up. But then, you know, anytime I see people trying to conceive, I feel it, because I was there before. So I pray that the Lord will visit you, the Lord will perfect everything that concerns you. He will give you that. I'm fine, Stephanie. I'm good. Where are you watching from? Please let me know where you are watching from, because I can see so many people here. I know someone said he was watching from Indonesia. Asking me, maybe I know Indonesia is Asia country. And just like I told you, I love traveling. One day you will just see me. You know, I love this Domion song that I believe that you should always thank God in whatever situation you find yourself. Don't allow negativity to weigh you down. So I love singing choruses. If you check my channel, you see that I love dancing. And most time to gospel music, because God has been answered. When people see me, they will say, you don't look like a widow. How do you want me to look? I cannot say because my husband died, I will not look like a mad woman. I still thank God for that I'm alive. It's not by my power. God has been keeping us. God has been helping me, to overcome so many things, and he's faithful in all his way to always meet me at the very point of my need. So I love this Domino song that says, I give you glory, I give you honor, I give you everything I am, lifting my hands and heart before you, Lord. I give you glory, I give you glory, I give you honor, I give you everything I am, lifting my hands and heart before you, Lord. Who else? There is none, but the reason why I came, then to glorify your name. For you have been so good to me, Lord, that I offer all my life as a pleasing sacrifice. I'm so grateful to you, Lord. Oh, I give you glory, I give you honor, I give you everything I am, lifting my hands and heart before you, Lord. Ooh. Ooh, do you like my voice? Just, I enjoy praising God. I enjoy being in His presence. God is good. God is amazing. God is faithful. Thank you for the light. God bless you. Thank you. Thank you. I may come back in the night. So the topic I came to do, done justice to it. So I think I'll see you some other time. Thank you for coming. God bless you. Bye.